As India continues to battle with the COVID-19 pandemic, one important tool is vaccination. COVID-appropriate behavior and vaccination both will go a long way in saving lives. I am in a rural primary health center in Haryana, where you can see primary healthcare workers have been vaccinating Indians.
India is completely geared as far as immunizing the rural India.
Many say there is a digital divide. Many say there is a rural-urban divide, which is why on this episode of Life and Science with Pallav Bagla, we take you into rural Haryana to show you how vaccinations are proceeding. As India battles the second wave of the COVID-19 pandemic, the focus is very heavily on vaccination. India has embarked on an ambitious program to try and vaccinate as many vulnerable people as possible. I am in a peri-urban area of the national capital region in Palwal to try and see how vaccination is happening outside the big cities and in rural areas, and to explain to us the roadmap for vaccination and the science and public health policy behind vaccination. We have with us Dr. N.K. Arora. Namaskar, Dr. Arora. Thanks a lot for finding time with us. Dr. Arora is the chairman of the National Working Group on COVID-19 vaccines. And in a way, he sets the science and public health policy around vaccinations for 1.3 billion Indians. Dr. Arora, thanks for finding time with us. India embarked on a vaccination effort several months ago. So far, are you happy with the program?
I must say, beginning has been very encouraging. We started with 3,000 immunization centers in the country, and yesterday I saw it was 45,000 immunization centers across the country. Every primary health center and CHC are now administering vaccines. During the first week of April, we had 75,000 immunization centers. In a way, our capacity is to immunize almost 1 crore of people every day, and we are very well placed. Although the initial response was lukewarm, but as the things have moved, and particularly with this outbreak of second wave, now we feel that more and more people will come on their own and get the vaccine. And country is getting geared for ensuring that every eligible individual in this country gets COVID vaccine by the end of the year.
There is a feeling that there is a shortage of vaccines. How true is that?
See, when we prepared the national priority list in September-October 2020, we knew how much vaccine will be available in first 5-6 months. And accordingly, the priority group was set up that all those above the age of 45 or 50 will get the vaccine, and the population above 45 years is about 30 crores. We had made arrangement for about 50-55 crore doses. However, somewhere down the line, from 1st May onwards, it was also opened up for 18 to 45 age group, where we have a population of 65 crores. So therefore, a relative shortage has become apparent during last 4 weeks or so. But I am very happy to share this information that over next 4 weeks or so, we should be over with this shortage. By July last week or first week of August, we should be having about 20 to 25 crore doses every month. And in another month's time, by September, we should have about 30 to 35 crore doses per month. And we should be very easily immunize 1 crore individuals every day. And I must also say that we are also getting geared. A trial is going on, and 2 years to 18-year-old children are also being evaluated for the safety of vaccine.
We'll talk about that. We are standing in a peri-urban area in Palwal, and we have with us Dr. Brahmadeep. He is the Chief Medical Officer of Palwal district. Dr. Brahmadeep, thanks a lot for speaking to us. How is the vaccination effort outside the mega city of Delhi going on?
Yeah, I would like to say that the vaccination, it started in January. In the beginning, it was healthcare workers who were vaccinated, then the frontline workers, and finally coming to the general public, that too in phases, 60 above 60, then 45 to 60, and then 18 to 45. I would say that it is a marvelous planning that step by step, in a staggered way, we are reaching to the masses, and that is the success behind it.
Let's now go and see the vaccination center in this large civil hospital. Let's go. We are in the Corona Vaccination Center in Palwal. Dr. Arora, you have seen the vaccination which is happening. I was told you are the first person to get the vaccine in this particular area and district. What you see behind you, is it a good center?
First of all, I feel very honored. On 16th January, I was the first person to get the vaccination here, and I got the Covishield vaccine. And I feel it's like a dream come true. The way it has been organized, it's exactly replica of the way it has been planned at the national level. So it's a pleasure to go through the immunization center.
Dr. Brahmadeep, how many people are you vaccinating, and what is your strategy to make sure that you don't run out of vaccines?
We have got 5,000 doses available with us. We would plan the session for 4,500 doses, keep 500 as reserve for the next day, and meanwhile we will arrange it logistically so that it is never short. Secondly, talking about the vaccine at one session, generally the session ranges between 100 to 200, but if there is a place where we are having more number of people coming up, we would increase the manpower to double and make the session as 400 people session.
Thanks a lot for explaining to us, Dr. Brahmadeep. We will now go and see one of your rural centers where vaccination is happening. Let's go, sir. We saw the urban setting where vaccination was happening. Now we are in rural Haryana to see what is happening on the COVID vaccination front in rural areas. Dr. Arora, there is much talk about a divide between urban and rural India in vaccination and between digital India and vaccination. What do you have to say to that, and how can that be bridged?
See, immunization is not something new for this country. Right from 1980s, we have been immunizing, and India's immunization program is the world's largest immunization program. And we have 100,000 immunization centers across the country. And 65 to 70% of India is rural. So immunization, the infrastructure required for immunization is available throughout the country. And the last point, although delivery of the vaccine is in the village, but last point in terms of storage of vaccines is in PHCs and CHCs. And in this country, we have 29,000 cold storage points where vaccines are stored. So there is absolutely, this is not something unique that we are doing it for the first time. India is completely geared as far as immunizing the rural India. We can take care of the whole country without leaving the remotest part, northeastern part, rural, tribal, any area we have the presence. Second question you asked about
Digital.
digital divide. Actually, the most important, I think the highlight of this particular program is that for the first time a dream has come true. A Cowin platform is a digital platform where we know exactly how many people have got the vaccines, what vaccines have been given, who has received it, and how many people have been left out. Plus, also we know that if somebody has received only one vaccine, how to track that person. So that whole information, it cannot be done manually. I must clarify here that our digital platforms work offline also. You don't have to have internet connection
So
right at that
meaning
time.
you don't need to have a smartphone to get a vaccination in this particular rural PHC.
Absolutely, it is not required. If you have not registered yourself, walk in, get yourself registered. You will be registered on the Cowin app or Cowin platform. You will be documented. You will get the vaccine. And even if you don't have a smartphone, if you have ordinary phone and which penetration is over 95% in the country, so you can get a SMS on that, and once, and that is your first certificate, and this, you will get a reminder for the second dose at the appropriate time. So what I am trying to say is, even if I don't know how to register on Cowin platform, it will still work, because most of the immunization so far which is happening in rural areas is walk-in immunization.
Let's go and see the actual vaccination happening here. Now we are sanitizing our hands. Thank you very much. Namaskar. बहुत धन्यवाद आपका. Let's go inside. Dr. Arora, now we are in a rural community health center where vaccinations are happening in the background. Let's come a little forward, sir. You told us that there is not much of a digital divide issue in India's vaccination program. Now, going forward, right now we have two vaccines plus Sputnik, which is also being implemented. Are we looking at mixing doses? Are we looking at single doses? And how will we track them?
So that's a very important question, because today it is two vaccines. Another 2 weeks we will have the third vaccine, and over next 2-3 months this country will be one of the unique where we'll have 5, 6 or 7 vaccines simultaneously being administered in different parts of the country. Now there is some scientific evidence that vaccines manufactured on different platforms, all these vaccines, COVID vaccines are manufactured on 5 or 6 platforms. Now, if can I use this different platforms to improve the immunizing capacity or effectiveness of the vaccine? Can I still maintain the safety? And the third is the programmatic feasibility. See, if I go here inside, I will find two vaccines. Now, two things can occur. In fact, we have read in the newspapers in last 4-5 days that some errors have occurred. Somebody received one dose Covaxin, the second Covishield. So, scientific studies are being planned so that can we mix the two vaccines, dose 1 of a particular vaccine, dose 2 of a second vaccine. So as I said, there are 3 purposes. One is better immunity or better vaccine efficacy. The second is it should remain the safety, mixing should remain safe. And the third is, if by chance or by mistake, if the mixing occurs, people should be feeling safe that nothing is going to happen. And for this, the studies are being embedded into the program so that they are done, but proper ethical clearances, regulatory clearances are required. And so it will take 1 or 2 months to roll out these studies, but we will try to do various kind of combinations.
What about single dose vaccines? Because that will double your literally the number of people you can cover.
Yeah, so in fact, there are two vaccines which are already on the horizon where it is only single dose. One is Johnson and Johnson vaccine, which is a single dose vaccine. Sputnik also has a version which is only single
The
dose,
Sputnik Light.
Sputnik Light. Then the mRNA vaccine, in fact, Moderna may be coming with a single dose. Pfizer may be coming. Now, many of us are not aware that one of a game changer vaccine is being completely manufactured in India. It is an mRNA vaccine manufactured by Genova. There is a possibility that this vaccine will also have a single dose.
You also have a DNA vaccine.
And India is the only country where we have a DNA vaccine, and it will be rolled out in June. So we have very unique components. I don't think any country globally can compete in vaccines, the variety of vaccines we'll have. And we should be able to immunize 1.3 or 1.4 billion people by the end of this year.
You're giving a very big number. I will hold you accountable to this at the end of the year. We will talk more about that.
We will.
Let's also dwell a little bit. Right now, our focus is on the 18 plus age group. What about the young children? They have to go to school. How soon can we get a vaccine for children?
So the country, 2 weeks ago, country has started a vaccine trial for children between the age of 2 years and 18 years. The result should be available by the end of September. And this is Bharat Biotech. Covaxin is the vaccine which is available here also, as I understand. And once the results are available, we will be able to immunize our children also. The target is that across the age group, we should protect our population, and so that the kind of concern and the health system difficulties we saw during last 8 weeks, it should not come back again in this country.
Let's go and see the actual vaccination which is happening inside, sir. We are in the Allika Community Health Center where COVID-19 vaccination is happening, both with Covaxin and Covishield. And you can see there are many people here who are waiting in queue. But is there hesitancy? Dr. Arora, by now we have reached about 2 or 3% of the population of India. Is there hesitancy in Indians to get a vaccine done?
So, to say that initially there was hesitancy, because adult immunization was happening for the first time in this country. And there was a kind of a vague, unexplained fear among community. And particularly elderly, because we were targeting them, they thought that they are having otherwise a stable life. We don't know what has happened. So this was fear of unknown. But over the time, this fear has gradually diminished. And now we find, and particularly I think there is a positive side, that because of massive increase in the cases which occurred during last 8 weeks, people now feel that immunization is an essential part to prevent at the moment from severe disease, and also preventing the next round of similar kind of outbreak. So over the time, vaccine hesitancy has reduced, but still I would say there are pockets. We need to constantly work that immunization is accepted. There is a demand in the community, and we have to work with the community and make them aware.
Let's go inside and see how it is happening, sir. Please. We are in the primary health center at Allika village in Haryana, where COVID-19 vaccine and vaccination is happening. Dr. Arora, can you explain to people, because a large part of India is still unvaccinated, how does this whole thing happen?
Now, once we come into the immunization room, there are 2 or 3 very important components. vaccine should be maintained at a temperature so that its effectiveness maintained. And this is called a vaccine carrier, where there are these cold water ice packs.
हाँ, ये तो ठंडा है एकदम.
Yes,
This is cold.
yes. And the vaccine is kept here. Thereafter, when the vaccine is to be given, it takes about an hour or 2 hours, because this is a 10-dose vial and this is a 10-dose vial. And even this is a cold pack, ice pack. And so that temperature is cold. This is cold. Can you give her the vaccine? Please, इनको vaccine दीजिए. Now, this is very important, that at what time the vaccine vial has been opened. So, because once vaccine is opened, it has to be used on the same day. And time has, so 12:45, and I see it is 1:15. So just half an hour ago, and it, so that to minimize the vaccine wastage, timing, numbers, number of people waiting, everything has to be taken in account. So, and this vaccine can be used till 4:45. His credentials are rechecked and his name is entered. So this issue of digital divide, in case internet is not working here at the moment, data is entered, and after that in the evening and whenever the internet is available, it is uploaded, because all the Cowin platform works on offline also.
मैं अलीका गांव सेंटर में कोविड का इंजेक्शन लगवाने आया तो मुझे बहुत अच्छा लगा, और मैं 15 मिनट में पूरा प्रोसीजर हो गया. मैं आगे और लोगों को भी सलाह दूंगा कि वो भी इंजेक्शन लगाएं.
अलीका गांव आए थे वैक्सीन कराने के लिए, तो मात्र 2 या 5 मिनट में वैक्सीन हो गई और काफ़ी अच्छा लग रहा है यहाँ आके. और आगे भी जाके भी काफ़ी लोगों को बताएंगे कि यहाँ पे मतलब हमारा स्लॉट आया था, तो काफ़ी मतलब वैक्सीन में काफ़ी टाइम नहीं लगा, जल्दी ही लग गई थी. और भी कोरोना जैसे चल रहा है, तो सभी को यही है कि सब लोग टाइम से अपना लगवाएं वैक्सीन.
About 100 people get vaccinated at this particular site every day. Dr. Arora, we are a country of 1.3, 1.4 billion people. We have roughly covered about 2 or 3% of the population. What is the roadmap for future?
So, as of yesterday, about 22 crore doses have been given. 2 doses have been received by about 4 crore people, and I'm remaining about 14-15 crore have received at least 1 dose. So if you look at overall, at least 10% or 12% people have received at least 1 dose. Now, we intend that by July we should have this 30%, 30%, yes, 30% population should be immunized. That means about 40 crores or 35 crores should be immunized. The critical factor or bottleneck will be community acceptance, and you asked the right question. The vaccine hesitancy, vaccine acceptance, and the demand for vaccine. And I think as a nation, as a country, we have to really work hard. Social mobilization and community engagement is a very important component, and all of us have to work together.
जन आंदोलन चाहिए.
जन आंदोलन चाहिए, तभी होगा. क्योंकि ये जो पिछले 2 महीने में, last 8 weeks, whatever we have faced, many times we forget very easily, and we should not allow that to be forgotten, that it is a very serious disease. Otherwise, we can, all of us, land up in that kind of a scenario. And vaccine is a very important component.
Vaccine saves lives.
It has saved my life. I was the first person to get Covishield, probably in the whole country. I received at 10 o'clock on 16 January. Then I received the second dose on 22nd of February. Unfortunately, because there was a widespread in our house, everybody got infected. Me and my wife, both of us were infected. But we had minimal infection. I did not stop working even for a single day. And but my son, who had not received, because he is younger than 45, he was to be admitted in a hospital for 3 weeks. So I think vaccine has saved me. Otherwise, at my age, it would have been really difficult.
Dr. Arora, I'm happy to hear that it saved your life. I can also say vaccine saves life. I got 2 doses of Covaxin, and 24 days later, I developed an COVID-19 infection. And I was admitted to a hospital. But for sure, my life was saved by Covaxin because I did not go on to the intensive care unit. I did not go on to a ventilator. My disease remained moderate. And towards that, it is the vaccine and the healthcare workers at the All India Institute of Medical Sciences, New Delhi, which really saved my life. So go get vaccinated. Vaccinate, vaccinate, vaccinate. That is what is required. If India has to fight COVID-19 and win the battle, then vaccination is a very important tool. COVID appropriate behavior is another important tool. So my plea to everybody, go get vaccinated when your turn comes. Dr. Arora's life was saved. My life was also saved. Thanks a lot for speaking to us, Dr. Arora.
Thank you very much.
Telling us the roadmap for India's vaccination strategy and how we are likely to achieve our target. If all goes well, by the end of the year, Dr. Arora says, almost the entire population of India would get vaccinated. But the big question remains, will we have to get vaccinated year after year for COVID-19? That still remains a scientific question that needs to be answered. Keep watching India Science.